Bobacki, Fleetwood, Pennsylvania. Hello, my name is Lisa, and I live in Fleetwood, Pennsylvania. 15 years ago, my healthy 42-year-old husband was found deceased on our couch by our then 13-year-old son. Our 10-year-old and 3-year-old stood quietly crying on the stairs. Sudden cardiac death was the cause. The same day, my daughter asked if we would need to move to another house. I promised her that I would do everything I could to keep us in the home I would promise to keep them in the only home they'd ever known. Those early days remain blurred in my mind. I remember my father taking me to the Social Security office, and shortly thereafter, survivor's benefits for my children began showing up in the bank account to assist with their care. If not for these benefits, I would not have been able to keep my promise to my children. It's not much money, amounting to roughly the salary of a minimum wage job, yet it was a lifeline to some piece of normalcy for my family, not a Ponzi scheme. My kids have now aged out of the system. I'm about to begin widow's benefits as my body cannot continue to work multiple jobs as a physician therapist, which I've needed to do to make ends meet for myself and my family. Social Security benefits were essential to the care and being of raising my children. It was a promise from their father, who had paid into the system his entire working life. We must work on continuing to expand these essential benefits and never consider dismantling or privatizing them. Thank you, Senator Booker. Here's Cayana Spooner from Chippewa Falls, Wisconsin, who writes me. My name is Cayana Spooner, and I live in Chippewa Falls, Wisconsin. I'm 63 years old. My husband, Joe, and I have 5 children and 3 grandchildren and live a wonderful life as our family is growing. God bless you and your family. We owned businesses and worked to contribute Social Security for ourselves and our employees. We did all the things we could do to secure our future and contribute to the larger community of those in need. We felt that we were living the American dream until one day in 2012, I know this personally with my dad. I feel for you, Ms. Spooner. So one day in 2012, I was diagnosed with Parkinson's disease. Parkinson's is a degenerate Parkinson's disease is a degenerative brain disease that progresses over time. Sorry, I'm thinking about my dad. It is unrelenting and affects motor and nerve processes. Loss of benefits will have a direct and daily effect on me and my family as we navigate the medical needs we will be facing. I will need progressive and comprehensive care as I age. I will need medication every single day of my life. And I will need the security of a generous society to care for me. Millions of others join me there. Please, Senator Booker, please protect my Social Security. I just thank God that my mom had the resources to take care of my dad. And I watched that degenerative disease take from his life for 20 years and how much it cost, the thousands of dollars it cost my mom to take care of him. I know my friend Andy Kim, who's in the Senate right now, is facing health challenges with his father. I know so many people personally whose parents have Alzheimer's. I know so many Americans who are not powerful, they're not rich. I know so many Americans who live in fear every day that one little thing will happen to them that will destabilize their financial well-being. And now those millions of Americans, because of a president and a man named Musk, are driving fear into them, are whacking away the people that answer phones, are firing the people in an agency that already was struggling with wait times, that already was struggling with slow response times. These people who are hanging on by a thread in their lives are facing the people they love the most, who are struggling with the diseases that so many of us in this body have been affected by. They are now worried. They're writing me letters with words like fear and terror. They're talking about staying up at night and not being able to sleep because they don't have a president that comforts them. They have a president that talks down to them, that lies about the services that they rely on. What is this? It is not normal. It is not normal. This is America. How can the most powerful people in our land not comfort others, not tell them they have nothing to fear but fear itself, not tell them to have malice towards none but have charity towards all? What kind of man is in our White House that makes fun of the disabled, who lies so much that the fact checkers lose count, that minimizes the pain and the suffering? Where you have cabinet secretaries that are billionaires themselves that say, if my mom misses a Social Security check, but if somebody else complains about it, they're probably a fraudster. These people are not fraudsters. They're hurting. They're afraid. They're worried. For God's sake, this is America. Every one of our founders' documents is riddled with words that speak of our commitment to each other. Yeah, they were imperfect geniuses, but they were people that aspired to virtue. They read the greatest philosophers of their times. They said, what does it mean to be good to one another? What does it mean to create a society that is not run by despots and dictators who are so disconnected, who talk down, let them eat cake? They dreamed of a different country than this, folks. They dreamed of a different country than this. They dreamed of a country that stood for not just get all I can for me, the biggest tax cuts possible to the wealthiest people. They dreamed of a nation where any child born in any circumstance from any place could grow up and have their American dream. And God, it gut wrenches me when I hear people not as privileged as me, and I'm not Musk and Doge, but my mom had the resources and the family to support her as she watched my dad die of Parkinson's disease. But this person's writing in, she herself has Parkinson's. She underlines and bolds the part of her letter. She says, and I'll read it again because, Spooner, I want you from Chippewa Falls, Wisconsin, to know you are seen, to know you are heard, that know that maybe the president will talk down and cut and malign your only paycheck, your only hope, but I won't. I won't. I see you. I feel you. You can't lead the people if you can't love the people. And I'm sorry, our president is not showing that. He may be saying those words. She writes, with Parkinson's, I still remember my dad telling me he had it. She writes that it is unrelenting Parkinson's and affects my motor and nerve processes. Loss of benefits will have a direct and daily effect on me and my family as we navigate the medical needs we are going to be facing. I will need progressive and comprehensive care as I age. I will need medication every single day of my life. I know this. I know you will. I know you will. I will need the security of a generous society to care for me. A generous society to do the basic for families in this kind of struggle. Millions of others join me there. Protect my Social Security, Senator Booker. I tell you, I am going to fight for your Social Security. I'm going to fight to protect the agency. I'm going to fight against unnecessary cuts that hurt the service it gives. And today into tomorrow, I'm going to stand as long as I can. As long as I can, I'm going to stand and read stories like this because you are seen, you are heard. Your voices are more important than any of the 100 of us. More of your stories should be told on this floor of people that are scared right now, terrified right now, people living in rural areas that see their local Social Security agency on a list that Elon Musk put of places he's going to sell away to the private sector, and you're going to lose your agencies. Well, I will fight. Sorry. Margaret Hebring from Chippewa Falls, Wisconsin. Chippewa Falls, 2 letters. My staff is keeping me on my toes. This is another person from Chippewa Falls, Wisconsin. My name is Margaret Hebring, and I live in Chippewa Falls, Wisconsin. I'm 77 years old, and I am a member of the Lakota Ore Band of the Lake Superior Ojibwe. My husband is a veteran and who currently, I'm so sorry. My husband is a veteran who currently has cancer, and he's receiving chemotherapy at the VA hospital, which we have to travel to, which is over 100 miles away. And without our Social Security, I'm not sure what would happen to us. We would for sure have to sell our home. I have savings that will last me 1 month. I have savings that would last me 1 month right now. We live paycheck to paycheck, so please, please protect our Social Security. This is Judith Brown. We're moving away from the great state of Wisconsin. We're going to the great state of North Carolina, where my dad is from, up in Hendersonville, Asheville. But this person, Judith Brown, is from Charlotte, North Carolina, one of my top 5 favorite non-New Jersey states. I don't know if my friend Andy Kim has his top 5 favorite non-New Jersey states. New Jersey obviously is the best. Don't look at the senator from Connecticut, and I hate to tell him that Connecticut is not on my top 5 non-New Jersey states, even though I got educated there. I'm sorry about that. I'm sorry about that. The presiding officer is such a good man. His state is not on my top 5 non-New Jersey states, but North Carolina is, and I'm going to read a letter from Judith Brown. My name is Judith Brown, and I live in Charlotte, North Carolina. I was 17 when I started working and worked for another 20 years as an administrator until I had to be declared disabled. Without disability, I would not have been able to see my specialist, get an eye care, or any of the other needs, that I had. I was also the mother of 2 young sons who are on the autism spectrum. Without disability, I wouldn't have been able to take care of them and get the care they needed to be independent young men. God bless them. I hear that they want to close the field offices and change the customer service line. As a person with mobility and vision impairments, this is outrageous. I need to be able to access it the best way I can on the times that I can access it. Please, Senator, fight to protect Social Security for a senior like me and for young people with disabilities like my sons. Thank you. No, thank you, Judith Brown. Thank you for writing a letter. Thank you for speaking up. Thank you for not being silent. Thank you for advocating not just for your family, but for the millions and millions of other Americans who lean heavily not just on their Social Security checks, but on the incredible public servants that keep that agency working, and who wish to have a president that said, I'm going to bring the best of business experience to my customer service. I'm going to bring the best of caring and technology and innovation. I'm going to call the best computer technologists, scientists in the country. We're going to make this the best Social Security in the history of our country. And you know what, my friends, the billionaires I had on stage with me when I was inaugurated, I'm just going to ask them to pay a little bit more, 0.00001% more of their net worth to make sure that Social Security is safe forever. I'm sorry, it's crazy. I'm going back to Pennsylvania. I mean, it's almost like you can't make this up, honestly. I just know my country. I know our character. I know how good of a people we are. I know how much we love one another. I know much how our faith in red states and blue states and right and left. I've sat next to people on planes who introduced themselves to me as Republicans from a red state, and by the end we're laughing and talking and sharing stories. We are a good nation. Together we can be so great. We've shown that. But how can we have a president that in 71 days drives this much fear into our country? It's absurd, everybody. It's absurd. This is why I can't let this be normal anymore. Michelle from Lancaster, Pennsylvania. My name is Michelle Groover. I love your last name, Michelle. From Lancaster, Pennsylvania, and I would definitely be impacted if something would happen to my Social Security. Michelle also has Parkinson's, and I'm on disability. And the money that I have goes pretty much to the most of my medications and foods that I need to eat to keep myself going and strong. That's how it would impact my family. I wouldn't be able to afford also my insulin for my diabetes, Parkinson's and diabetes. So it's a challenge every month, as it is even with the amount that we have, because the cost of pharmaceuticals and things keep us going. Yes. So that's why Social Security is really important to us as a family. It helps us get by every day. Thank you. This is Patricia Harvey Porter from Johnstown, Pennsylvania. Hello, my name is Patricia Haney. Excuse me, Ms. Porter. Patricia Haney Porter. I reside in Johnstown, Pennsylvania. My work is varied. I've been employed as a secretary in the private sector, as a statistician for the government agency, as a real estate agent, and most recently as a legal secretary. This is my story as to how Social Security has affected my life. My mother passed away in 1956. My sisters and I, God bless you, were 8, 10, and 11. My maternal grandparents stepped in and they raised us with the help of Social Security survivor benefits, resulting in good educations and allowing other needs to be met. We had almost normal lives due to these benefits. While raising 2 children, I worked as a real estate agent. My income was based on commissions rather than salary, so I made the entire Social Security payments based on my income. We had a roof over our heads, healthy food on the table. One of my children had serious medical issues, and I paid for her bills out of pocket, never asking for a penny from any government agency. These expenses were paid for from my income, and I paid taxes every year. I waited until I was 70 to collect my Social Security benefits, as I realized the latter you collect, the better the benefits. I have no pension, and I live almost entirely on Social Security benefits. I am always looking for part-time work, but few people want to hire me, as I will be 80 in June. God bless you. God bless you. Based on the benefits I receive, I'm able to pay my mortgage and all monthly expenses. I receive Medicare, which help pay the medical bills. So Social Security and Medicare be taken from me, I will likely lose my home. I could no longer afford medical costs, groceries. I have a medical condition which requires regular visits with a specialist who is 70 miles away. Without Social Security and Medicare, I would no longer be able to see him, and my condition would result in death sooner rather than later. Thank you for all you are doing to see that the benefits received through Social Security, Medicare, and Medicaid will continue. As Senator Murphy and I was talking, it's all interrelated, right? This is somebody on Social Security, but they have to drive just for medical attention. We are in a hospital crisis in America. There's so many rural areas where rural residents of our country have to drive so far just to get to a hospital. And cuts in Medicaid, we've heard it from the letters I wrote in the read in the last section, will endanger those hospitals' survival. Charlotte, North Carolina, again, Kevin Woodson. We get a lot of letters, my staff, from Wisconsin and Charlotte, North Carolina. Okay? My name is Kevin Woodson. I'm a 69-year-old retiree living in Charlotte, North Carolina. I worked 38 years for 2 Fortune 50 companies. I'm sorry, Kevin. And I thought that I would have a fully funded pension plan to live off in my retirement. However, I never got to the 25 years in, so only got partial pensions. This is why I need Social Security. It covers the holes that the pensions don't cover in terms of medical benefits. It allows me the freedom to enjoy my life, take care of activities that I need in order to keep myself healthy. Social Security is dependable, something I rely on, not a Ponzi scheme. And I hope that we don't touch Social Security and that we don't have any issues trying to keep that money flowing. It's money I paid into. Margarita Silva from Surprise, Arizona. I love that name, Surprise, Arizona. Hello, my name is Margarita Silva. I live in Surprise, Arizona with my husband. I started working at the age of 15, doing volunteer work as a candy striper at the hospital where my mother worked. I did not get paid. After that, I started working as a waitress, earning 50 cents an hour. After graduating from high school, I took various jobs, earning a little more, and then I started working at Mountain Bell, and I retired after 30 years from Quest. So if they do Social Security cuts, I don't know what I'm going to do. I will be forced at the age of 74 to look for a job. So those are my hard-earned benefits. I worked for that. More than 30 years, I worked for that. Thank you. Wayne Bank from Chippewa Falls, Wisconsin. I need to go to Chippewa Falls, Wisconsin. This is the 3rd letter you guys are having me, and that are included, the people reaching out to me from Chippewa Falls. God bless you. I need to visit your community. Hello, I'm Wayne from Chippewa Falls, soon to be 69 years old. I've been on Social Security for a couple years. My wife and I spent years in the service, Navy, And again, like I said, my wife and I are going to have been on Social Security, saying that we would, if we lost our Social Security tomorrow, we would lose our house, our cars, and pretty much our livelihood, because this is what we've worked for and we don't need to lose it. Why do you work for 55 years and pay into Social Security and then lose it? Recently, I tried to get back online, get on my Social Security account. I wasn't able to. Because of that, I went down to the Social Security office in Eau Claire, Wisconsin, and they said they couldn't do anything for me, that I had to set up an appointment. So I come home later, called, set up an appointment, and it's still 3 days out before I can get my appointment. And they don't know if they can help me. So at this point in time, I really need to know what's going on with Social Security, Senator Booker, because if we lose it, everybody else that's on it loses it. We're going to be in a really sorry state. Those folks who answer phones and set appointments, they're sure important. When somebody is in a crisis, they have to wait a few days, their check is missed, and it's real consequences for real people. Hello, my name is Manuel. My wife and I live, surprise, surprise, in Surprise, Arizona. We're both on Social Security, and that's what we depend on to live our lives in our retirement years. We have to pay our bills. We have to buy food. We basically have to live off that. So if you take our Social Security, what are we going to live off? Are you going to take care of us? You know, we're American citizens, and we deserve, and we paid into it, and we've earned it. And it's not just something given to us. So leave our Social Security alone. Let us live our lives. Let us live our lives out the way they should be. And we're supposed to be in our golden years, so it's important to us. It's important to all Americans out there that are seniors. Let us live our lives. Thank you very much, Senator Booker. Patricia Nton from Pittsburgh, Pennsylvania. I lift your voice. My name is Patricia Nton, and I'm from Pittsburgh, Pennsylvania. I've been paying into Social Security since I was 16 years old. I am currently 70 and have been collecting Social Security for the last 5 years. Without Social Security, I wouldn't be able to pay my mortgage, utilities, food, medicine, co-pays, and many other things. I would not be able to survive without Social Security. There's no reason that seniors should be held hostage over Social Security. This is our money that we put into the Social Security system for many years. We deserve not to be threatened by the loss. Thank you. Kathleen Wooverding from Hanover, Pennsylvania. Hello, my name is Kathleen Wooverding, and I currently live in Hanover, Pennsylvania. I'm originally from New Jersey and taught in the public school system for 29 years as a school librarian. When I retired, I decided to move to Hanover, Pennsylvania. Kathleen, you're missed in Jersey. And at the age of 62, I started collecting Social Security because of COVID. I needed the extra stability that Social Security provides. I no longer have to work a full-time job because of Social Security, although I do work a part-time job and still pay into the system. Social Security provides me with stability, financial stability. It helps pay the bills, and I really don't have to worry about my finances because it's Social Security. If Social Security is taken away, I will lose everything I worked for over the past 60 years. I feel that Social Security is a godsend. Protect it, Senator Booker. Thank you. Cynthia Marino from Pennsylvania. My name is Cynthia Marino. I'm a retired registered nurse from Lancaster, Pennsylvania. My husband died in 1990, and 2 of my children received survivor's benefits for 8 years, during which time I was able to get my bachelor's degree in nursing and work part-time. All 3 of my children went on to get college degrees. When I was 61 years old, I went on Social Security disability, having a hip replacement. I was switched to regular Social Security when I turned 65. I now deeply depend mostly on Social Security for my husband and myself, with small pensions from both of our jobs supplementing the Social Security. I'm now able to live independently in a handicapped mobile home, thanks to the money for Social Security in the past and present. Much cheaper than Medicaid funds to keep me in a nursing home. Thank you, Senator Booker. Protect it. Thank you, Cynthia, for your story. These are just some. These are just some. I read their voices. I lift their voices with mine. I want to go to the Detroit Free Press, but before I read this article, I know my senator from New Jersey is here, and I'm going to read this article, and if he is interested in our 6th hour, if he has a question, I will yield a question while retaining the floor, but I'm going to read this article and then we'll go. This is from the Detroit Free Press. My mom was born in Detroit. I love the city. My family owes it a lot. So when my grandfather went to find a job on the assembly lines in Detroit, building bombers during World War II. It says, Kathleen Sherrill's been retired for 10 years now and typically didn't think twice about whether she'd receive Social Security payments on time. For the first time ever, the 74-year-old Troy retiree went online in March on the very day that $2,800 was to hit her bank account through direct deposit. She suddenly felt compelled to make absolutely certain that her Social Security money was there when it was supposed to be. Cheryl and other retirees are on edge. Big time. Call it Social Security insecurity. I have never really worried about it much as I have this year, Cheryl said. The money, thankfully, was sitting in her account in March, and she knew her checks and payments for her ongoing bills would not start bouncing. I think anybody, future or current people on Social Security, are definitely targeted, she said. It's a worry that I'm sure everybody is having right now. I know it because I heard from my mom and her whole senior community. Seniors uncertain what to do next for Social Security. Since early February, AARP has seen nearly double the calls to its customer service care line as more people began being troubled about Social Security. And it has shown no signs of abating, according to the AARP spokesperson. Since February 1st, AARP said it has been receiving more than 2,000 calls into its call center per week on concerns relating to Social Security. Social Security has never missed a payment, and AARP and our tens of millions of members are not going to stand by and let that happen now, said John Hishta, AARP Senior Vice President of Campaigns, in a statement last week. While those words sound reassuring, it's frankly not comforting to realize that seniors need to hear that their monthly Social Security payments will arrive as usual. I don't imagine anyone had this one on their bingo cards for March 2025, this kind of worry, stress. On social media, I spotted one comment that said, folks, the federal workers began advertising last month that all Americans remove all funds from the account where they normally receive any federal payments, Social Security, federal tax funds, and the like. Keep the account, but only use it as a place for feds to transfer money immediately, move all transferred cash to a separate account. The concern, according to the Post, quote, DOJ can declare you dead and force your bank to send back any funds paid to you. Whoa, a lot of retirement angst there, and yes, some wild notions and really bad advice. Moving Social Security money around to hide it in another account, different from where it's directly deposited, actually could put more of your money at risk when it comes to some debt collection. Anyone who's tracked retirement policy as I have knows that the potential unraveling of Social Security system has been discussed for decades. Many retirees just never imagined a convoluted scenario when someone would think Social Security possibly could implode. The health of Social Security, which marks its 90th anniversary this year, isn't all that makes many retirees and those about to retire nervous. Their anxiety can go into overdrive watching the stock market slide on Trump's tariffs news and seeing all the political ping pong with Social Security money that belongs in their pockets. The Trump administration has maintained that it wants to cut costs and fraud when it comes to the Social Security program, not benefits. But people remain skeptical, and some commentary isn't helping. Acting Social Security Commissioner Leland Dudek, in interviews last week, including one with Bloomberg News last Thursday, actually threatened to temporarily shut down Social Security after a federal judge temporarily stopped members of Elon Musk's Department of Government Efficiency from digging through personal data at the Social Security Administration. The DOJ operatives, according to the court, will first need to receive proper training on handling sensitive information, which some might say is the least they can do. The American Federation of State, County, and Municipal Employees, or AFSCME, Alliance for Retired Americans, and the American Federation of Teachers filed a motion for emergency relief on March 7th to halt DOJ's unprecedented, unlawful seizure of sensitive data regarding millions of Americans. No surprise, Dudek soon found it politically prudent to back off from his threat. I'm not shutting down the agency, Dudek said in a statement, indicating he had received clarifying guidance from the court about the temporary restraining order. President Trump supports keeping Social Security offices open and getting the right check to the right person on time, Dudek said. Financial tech CEO Frank Bisignano, who was nominated by the President Donald Trump to lead the Social Security Administration, ended up being grilled by Democrats about the bedlam during confirmation hearings before the Senate Committee on Finance on Tuesday. The angst isn't about to go away, particularly if people continue to face even longer waits on the phones or see Social Security offices closing in their community thanks to some key changes being made now by Trump's administration. Customer service is on the chopping block as the Social Security Administration reduces the number of employees, restricts what services can be handled by phone, and shutters some local offices where people could talk to someone face-to-face. On Wednesday, the Social Security Administration announced that it would initiate a 2-week delay for implementing a highly criticized move to end phone services and require in-person visits for some services. In-person identity proofing for people unable to use their personal My Social Security account for certain services will be effective April 14th, according to the announcement. But individuals applying for Medicare, disability, and supplemental security income who cannot use a personal My Social Security account can complete their claim entirely over the telephone without the need to come to the office, according to the March 26th announcement. That's good news for many. Even so, merely delaying the change doesn't help others, and frankly, customer service could still suffer in the long term. And it will get very ugly if current Social Security recipients miss out on even one dime of their benefits. At one point last week, U.S. Commerce Secretary Howard Lutnick suggested that his 94-year-old mother-in-law wouldn't complain about missing a Social Security check for a month or so. Only fraudsters would call, he said during an All In podcast. My thought, have you ever watched an exchange where someone on the Social Security is being denied a coupon or a senior discount at a store or restaurant? It's not pretty. Worse yet, has Lutnick ever talked with a friend or relative in his or her 70s or 80s who depends on Social Security to cover basic bills? Social Security provides retirement, survivor, and disability payments to 73 million people each month. The number includes about 56 million people who are age 65 or older. Some people, and even Cheryl includes herself in that group, are better off than others. They won't miss paying an electric bill or the rent because they can turn to retirement savings or money from a traditional pension. Even so, Social Security remains an integral source of income each month for all retirees and others who receive benefits. I'm concerned about my financial future, Cheryl told me. Social Security now represents about half her monthly income. She never imagined that any Social Security fix would involve cutting benefits for existing retirees. Some GOP proposals have suggested increasing the age for full retirements from 67 to 69 over an 8-year period beginning in 26, but now she fears it's possible her benefits could get cut at some point down the road. Overall, Cheryl has had fun in retirement. She has 9 grandchildren, 12 great-grandchildren, and wants to spend more time with them, not less. Cheryl and her friends who are retired are cutting back on eating out and entertainment just in case something happens to Social Security. High prices for many things put pressures on fixed incomes as well. She wants to take less money out of her retirement savings now so she has more money on the sidelines in case her Social Security benefits get cut. Even so, she's staring at an unexpected $600 new monthly car payment ahead because she needs to replace a car that was in an accident a few weeks ago. If Social Security payments are cut or stopped, I may be selling it. The wild swings for the stock market, 401k plans going down in America, has created more jitters for more people. The economy seems uncertain. Consumer confidence is in worse of a place. Leaders are threatening Social Security services. Offices are being cut. People are being laid off. So people are worrying. Taking a rough guess on just her 401k plan, she believes she's lost about $30,000 on her retirement savings as the stock market has tumbled. Over the years, she said cuts to Social Security were always a part of the political realm, but she felt that Congress provided a stopgap to any dramatic moves. She doesn't believe it's true anymore. I'm hoping Congress wakes up, looks in the mirror, and decides they don't like what they see, she told me. One big problem with fueling an atmosphere of chaos is that many people do start worrying about everything. One big problem with fueling an atmosphere of chaos means people stop believing that Social Security is a system they can depend on. Cheryl said she took a call from her college roommate who mentioned that she was going to look at her bank account online to see whether her monthly Social Security payment was stopped or had arrived as usual. I said, "You're going to be okay. I got mine this month." So many people afraid right now.
Will the senator yield for a question?
Yes, I will yield for a question while retaining the floor.
Thank you, Senator Booker, and thank you for coming to the floor tonight and speaking up. I have a few questions for you, so why don't you catch your breath. I wanted to start by saying how proud I am of you to represent our great state of New Jersey alongside each other. And it's not just me. I want to tell you, because I know you've been here in this chamber nonstop for hours, but I want to tell you that the people are paying attention. And they join me in thanking you in this moment. In fact, I saw a few posts I thought I'd share. Stacy from Bayonne said on Facebook, "I couldn't be prouder to be a lifelong New Jerseyan than I am tonight. Keep it up. Get in that good trouble. Lead the way, and hopefully others will follow." Janie in Princeton said, "Thank you. Proud that you are my senator and that you are bringing big Jersey energy to DC tonight." Vicky in Ewing said, "We are sending our strength to you. Medicare and Medicaid should not be touched." And someone on Reddit even said, "I hope he wore the most comfortable and supportive shoes he could find." In your opening, you said something that resonated with me. You said, quote, "Our constituents are asking us to acknowledge that this is not normal, that this is a crisis." I can't tell you how important it is to internalize it. That's why we're here at this late hour in the U.S. Senate. That's why you are leading here to make the case to the American people that this is a crisis. That resonated with me because I hear this over and over again. I hear it from people all over our home state, whether at town halls or other rooms that are packed, people saying this moment is not normal, this moment constitutes a crisis. And I'm glad you're speaking on the floor and said that, because what you've said isn't just Cory Booker saying that, it's that millions of New Jerseyans that we represent are saying it. And you are lifting up their voice. It's not just you're saying that, it's that millions of Americans who see something fundamentally wrong and they're angry about it. Now, I have some questions for my colleagues, but I want to add some context for this because I want to dig in a bit on why people are so angry in this moment and why what we're seeing from Donald Trump and Elon Musk isn't in response to that anger, it is the cause of it. A common refrain in the town halls that I've held is that people just feel like nothing is working for them. There is a promise, a uniquely American promise, that is simply going unfulfilled for too many. Now, that promise is simple. Your government will work for you. Your economy will allow you to advance if you work hard and give your kids a better future. And your country will keep you safe by ensuring the world is stable and secure. And Senator, you and I are here because we know that this promise is going unfulfilled. To say that the American promise is going unfulfilled would be a tragedy in its own right. It would be something that we as a Congress should put our entire focus into restoring.
resolution. We are concerned about the negative impact these deep cuts will have on the Americans living with chronic disease and other disabilities. But we are willing to draw your attention now to how devastating they will be on those with Alzheimer's and related diseases, including frontotemporal degeneration and Lewy body dementia, and their family caregivers. April Verrett, president of SEIU. Let's be clear, Americans have flooded congressional phone lines, rallied at town halls, and lifted their voices to make it clear that they do not want massive cuts to the health care and public services they depend on. Despite that, today, Speaker Johnson pressed a budget resolution forward that puts our nation on a disastrous path to ripping away health care from 80 million children, pregnant women, veterans, seniors, people with disabilities by gutting Medicaid. Lee Sounder, the president of AFSCME, this budget proves that extremists are more concerned with giving wealthy trillions in tax cuts than helping working people. Voters across the country are packing town halls to demand no cuts to Medicaid and SNAP. They're calling representatives asking them, please, save these services. They want their elected leaders who will lower rising costs, who will make it easier to afford rent and food. But instead of listening to workers, the House moved forward on a budget plan that will cause millions to lose their health care, increasing food insecurity for families, and jeopardize Medicare and Social Security in the long term. He calls this shameful. The Diabetes Leadership Council and Diabetes Patient Advocacy Coalition. We are deeply concerned about the budget resolution passed in the House of Representatives this week. This budget resolution will likely lead to cuts to the safety net Medicaid programs, which provides health insurance to almost 80 million Americans, including children, pregnant women, elderly adults, people with diabetes, and low-income adults and families. This action would disproportionately impact Americans who most need us, including those with diabetes or other chronic conditions who rely on Medicaid to access medications and technology that they need to manage their conditions. Members of Congress should instead work to ensure access to health insurance. Through the Medicare program, work to ensure access to health care without barriers for the most vulnerable Americans. Here's the Alliance for Childhood Cancer. Work requirements may also impact caregivers of children with cancer who are unable to work due to the demands of cancer treatment for young adults with cancer who may not be eligible for insurance via their employer or may not be able to work due to their diagnosis. Many young adults rely on Medicaid, especially the Medicaid expansion for coverage, and research shows a clear increase in survival for young adults with cancer in Medicaid expansion states. Unidos US. The proposed resolution would slash at least $880 billion from programs that have long provided life-saving, affordable coverage to millions of Americans. Medicaid alone serves 80 million people, covering nearly 40 million children, half of those with special health care needs and more than 40% of all births. In Latino communities, Medicaid reaches 20 million individuals, protecting nearly 1/3 of community members, more than half of Latino children, and roughly 30% of Hispanic elders. Without these vital programs, there'll be higher hospitalization rates, delayed diagnoses, and increased mortality. This would become the norm, placing an unsustainable strain on public health and national financial security. As Unidos US recently pointed out, these proposed cuts would represent the largest cuts to Medicaid in US history. coalition of survivors of domestic violence and sexual assault. On behalf of the adult and child survivors of domestic violence and sexual assault, we serve and advocate for them. We, on behalf of them, write to ask you to reject cuts to federal Medicaid funding. Survivors rely on Medicaid every day to escape abuse, to rebuild their lives after violence, to care for their children and families. Catholic Health Association of the United States and the United States Conference of Catholic Bishops and Catholic Charities USA. Weakening Medicaid through structural challenges such as per capita caps or block grants would undermine these values and risk leaving millions without access to essential health services. Furthermore, policies like work reporting requirements have shown clear evidence of creating artificial barriers to care, generating paperwork and bureaucracy while doing little to support people looking for work. These requirements also fail to recognize that most people on Medicaid already work and ignore the realities of low-wage workers. Caregiving responsibilities, health limitations, and studies have shown they frequently result in loss of coverage for eligible individuals and children. The Disability and Aging Collaborative and the Consortium for Constituents with Disabilities, on behalf of 107 national organizations and more than 230 state and local organizations. The undersigned members of the Disability and Aging Collaborative, the Health and Long-Term Service and Support Task Forces of the Consortium for Constituents with Disabilities, and allied organizations write to urge you to exclude Medicaid cuts, work requirements, or any changes that limit funding or eligibility from budget reconciliation or other legislation. People with disabilities, older adults, family caregivers and their children, direct care workers, and other low-income individuals and families depend on Medicaid every day for their health, safety, and independence. Medicaid enables our communities to go to work and to care for loved ones. It is our community's lifeline, and we cannot afford for any part of it to be cut. The Jesuit Conference. Programs that meet basic needs, such as SNAP, Medicare, and Medicaid, health insurance, premium tax credits, and Social Security, should be protected and remain as robust as possible. We oppose modifications that would have the effect of reducing important benefits or excluding vulnerable people from participating. Thank you, the Jesuit Conference. Why? I mean, we have just read dozens and dozens of letters from real people who are relying on these programs to take care of their elderly parents, take care of their loved one with dementia, to take care of their children, to take care of their adult children with disabilities, to take care of their children with special needs, to take care of their families, to take care of their communities, to take care of rural towns, to take care of the hospitals, to take care of people. Why? Why? Why are all of these people lifting their voices now, pointing to the crisis that can't be normalized, pointing to the challenges? Because we've seen this reconciliation process call for $880 billion of cuts, when, as I read earlier, there's only one place that the majority of those cuts can come from, and that would be hundreds of millions of dollars of cuts to Medicaid, which organization after organization told you it is already a delicate balance, that cuts to these programs could ultimately tear down people's access to life-saving benefits. People use the word dignity over and over again. Dignity, it is a value in our country that we treat our elders with dignity, that we give people struggling with chronic disease dignity, that we give parents who are slammed with the unimaginable diagnoses for their children, we help them to access dignity. People that we talked about that read their letters, they all said, we can help you find efficiencies. We can help you make the programs work better. We can help you. But why are you doing this if it is all part of a larger package to give tax cuts to the wealthiest Americans, to give tax cuts to billionaires? How does that work? That Elon Musk should get richer and richer and richer, and families who the love in these letters, who love their children, who love their aging parent, who love that person with dementia, even though they don't recognize them anymore, but that doesn't stop their heroic love. And they piece together their finances in a nation where housing costs are going up, food costs is going up, transportation is going up. They piece together the fragile finances of their lives. The Medicaid funding is one part of it that gets yanked away and everything unravels. Why, they ask? Why? They plead for help. They ask us to do something. I want to read some articles coming from a variety of backgrounds. But perhaps this one from PBS, a closer look at who relies on Medicaid. This is what PBS wrote. As congressional Republicans seek about $4.5 trillion, $4.5 trillion to extend expiring tax cuts, the federal government will need to find savings elsewhere. If you're going to give those $5.5 trillion that disproportionately go to the wealthy, you're going to have to find savings elsewhere. Experts say budget cuts could affect Medicaid coverage for as many as millions of Americans at a time when the program may need more funding, not less. The proposed House bill requires the Committee on Energy and Commerce to find $880 billion in spending cuts, which means some aspects of Medicaid, which the committee oversees, may be on the chopping block. Medicaid is a massive program that provides free and reduced cost health care for eligible enrollees. It offers critical coverage to a wide variety of Americans, including children, adults with disabilities, and older people in nursing homes. Even for Americans who have private insurance, Medicaid can play a part of their health care. That's because Medicaid is such a large ending of funding that so many aspects of the country's, so many benefit from the aspects of this country's health coverage. The public health insurance option is funded in part by the federal government and in part by states, covering around 72 million Americans. The government spends about $880 billion on Medicaid in fiscal year 2023, the most recent year for which there's data, according to an analysis by the nonprofit health policy research organization KFF. Medicaid is an extremely popular entitlement program, said Robin Rudowitz, director of the program on Medicaid and the uninsured at KFF. More than 9 in 10 adults say Medicaid is very or somewhat important to their local community, according to recent KFF polling. 40% of respondents said they wanted Medicaid funding to remain the same, while 42% wanted to increase funding for the program. Just 17% wanted to decrease funding a little or a lot. Some studies have found that expanding Medicaid can save money for states, including in spending reductions in corrections, healthcare, as well as mental health and substance abuse. Pulling away from the article for a second, that's so logical. Expanding health coverage for people with mental health challenges or substance abuse means an investment now and saves a lot of money to society later and saves them from being rearrested because of their disease. Back to the article. President Donald Trump has said his administration will not cut Medicaid benefits and will instead reduce spending by eliminating waste and fraud. Well, according to health policy experts, there may not be a way to fund the tax cuts without gutting Medicaid. Doing that will have real implications, said Allison Orris, Senior Fellow and Director of Medicaid Policy at the Center on Budget and Policy Priorities, another nonpartisan group. It's fair to say that if Medicaid is cut by hundreds of billions of dollars, people will lose coverage. But some of the ways in which they will lose coverage and health care access are a little bit tricky, she said. So who and what relies on Medicaid? Medicaid covers low-income Americans in all 50 states, as well as D.C. and the American territories, but the program's benefits are farther reaching. Medicaid pays for around 2 in every 5 births in the country. The program accounts for about 20% of both hospital funding and total health care spending nationwide, according to KFF. That organization's analysis of hundreds of studies concluded since 2014 largely found that Medicaid expansion helped cut hospital costs associated with uninsured patients. Many studies also found that Medicaid expansion helped with overall hospital funding and resulted in fewer hospital closures. And Medicaid, not Medicare, is the single largest payer of long-term coverage, including nursing home care. Here are some of the ways Medicaid is crucial for so many Americans' health care. Long-term care for people with disabilities. According to KFF analyses, 35% of Americans with disabilities have Medicaid. It's about 15 million people. That compares with 19% of people without disabilities, and the majority of whom have employer-provided health insurance. Currently, Medicaid covers about 60% of long-term care coverage, much of which provides care for younger adults with disabilities. Nursing homes. Medicaid is the primary payer of nursing care in the United States. It covers 63% of nursing home residents. For many older adults, Medicaid is the safety net. David Grabowski, professor of healthcare policy at Harvard Medical School, says an individual can be middle income their entire life and then reach the older long-term care years and have to enter a nursing home. Because nursing homes can be so expensive, families can quickly deplete all of their assets, then rely on Medicaid to cover long-term care. Another group, children. 37% of people enrolled in Medicaid are children. They account for only about 15% of the program's spending. In 2023, KFF found that of the 72 million people enrolled in Medicaid, about 30 million were children. Millions more children are enrolled in the Children's Health Insurance Program, which some states run with Medicaid expansion funds. They're tied. Forgive me, that's off this article. Back to the article. So far, political conversations have not yet focused on cutting CHIP. Rural maternal health. Medicaid covered around 40% of births nationwide in 2023, KF found, and nearly 50% of all rural births. Studies also show that being enrolled in Medicaid leads to improved health outcomes for children, including declines in infant and child mortality, preventative care visits on par with privately insured children, and even potentially positive outcomes into adulthood, such as improvements in education. That's what studies show being enrolled in Medicaid leads to. How about Native Americans and Alaskan Indians? 4 in 10 American Indian, Alaskan Native people are enrolled in Medicaid, the highest enrollment rate among any race and an ethnicity category. This includes about 23% of non-elderly AIAN adults and 44% of American Indian Alaska Native children. How the federal government funds states' Medicaid plans. Medicaid began as an optional program in 1966 alongside Medicare, with around 8 million people eligible for enrollment. By the 1980s, all states had opted into providing health insurance through Medicaid. Though eligibility requirements have changed over the last 60 years and vary by state, the most significant change to Medicaid was the enactment of the Patient Protection and Affordable Care Act in 2010. It requires states to cover adults with incomes up to 138% of the poverty line. After the Supreme Court ruled in 2012 that expansion for states should be optional, 40 states and Washington, D.C. have expanded Medicaid. 40 of our 50 states accepted federal funds at a much higher rate than the match rate for non-expansion. That is a good summary by PBS of how far-reaching this program is. How many Americans in every single state, from all backgrounds, both sides of the political aisle, independents, old, young, hospitals, businesses, care professionals, and more. This is who we are. We've expanded the program. We've made it better. We've brought improvements. And yet we're doing a process. It's not going through a committee. We're not soliciting the best ideas from both sides of the aisle about how to make it more efficient, more effective. We're not bringing in private sector professionals to give advice and input, or hospital providers, or people that are seeing things that we could learn from and craft legislation to make the program better. And the letters are even showing we're not even doing any of those things, and then we're cutting the very programs that allow people access to fresh, healthy food that then cause us to need more health care for chronic diseases. This alone would be bad enough if we were gutting a program with no input from professionals, if we were taking away health care from seniors, children, expectant mothers, the disabled. That would be bad enough. But why? Again, why? Because it's part of a larger budget package to give trillions of dollars of tax cuts disproportionately to the wealthiest Americans, and still add trillions to the national deficit. I talked about American Indian and Alaska Natives. I mentioned that. I've recently visited some proud Native Americans and heard their stories and was inspired by their conviction and their grit, and how under incredible odds they were able to create better lives after extraordinary oppression and vicious policies and more. They found a way forward. There's a disproportionate number of Native Americans and Alaska Natives that rely on these programs. People who have maintained extraordinary dignity despite promises made and promises broken. So many people are talking about that idea of a sacred trust that the richest nation in the world, to honor its ideals of freedom, has to focus on keeping people free from fear that one medical bill will throw their family in crisis, or fear that one diagnosis for their child will unravel their lives, or fear that if their parent gets dementia, there'll be no care for them. So much of this conversation is within this larger understanding of who we are and what do we stand for. I want to take a look at some of the things the Trump administration is doing that is going to undermine not just Medicaid, but health insurance coverage for Americans, for all Americans, and raise the cost of health care and negatively impact our health at a time when basic prices of everyday goods are going up. The president is making health care harder to access and drug prices even higher. I want to explain this. On his first day back in office, Trump rescinded a policy that extended the enrollment period for ACA plans. This policy gave Americans sufficient time to enroll in health care for the year, and enrollment in the ACA continues to go up as people see how affordable this program is and how they can get quality health care. But one of the first things he does is rescind a policy that extended the enrollment period. In addition to this, Republicans in Congress want to take away the tax credits that make health care more affordable for so many people. Millions of working-class Americans rely on Affordable Care Act tax credits to access affordable, quality health care and coverage. I could go on with the things. For example, currently these tax credits, they're set to expire at the end of this year. If these tax credits are taken away, families will pay up to 90% more for their health care, and 5 million Americans could lose their health care altogether. All again, if this goes through in 2025, billionaires and CEOs will get a huge tax break while working Americans relying on this tax credit will lose it. Think about that. This would allow billionaires and CEOs to get more of a tax break while these tax credits that help more Americans access health care would expire. For New Jerseyans, ending the ACA tax credit would make health insurance less affordable for 352,000 hardworking people and their families and would force 75,000 people to go uninsured, 75,000 people in my state alone. Last year, 24 million people chose Affordable Care Act plans during the most recent open enrollment period due to these expanded tax credits that made plans available for people for little or no monthly premiums and extended the enrollment period, which I just said the president has rolled back. President Trump also overturned an effort for Medicare to lower drug costs, like implementing a $2 monthly out-of-pocket cap on certain generic drugs, as well as a measure that would reduce Medicare payments for rare disease drugs and drugs that treat life-threatening conditions. I just don't understand that one. I really see that as cruel. Americans struggling to afford their drugs had a cap of out-of-pocket expenses on certain generic drugs, and that was overturned. Costs are going up. Costs are going up. And now this president is expanding costs for out-of-pocket generic drugs, as well as Medicaid payments being eligible for rare diseases. I had the privilege of becoming close to John McCain. I came here in the Senate and got this admonition almost from Bill Bradley, somebody who held my seat beforehand, and he challenged me to go and have lunch with or meetings with all my Republican colleagues at the time. That was way back in 2013. And I was told by John McCain's staff that I had like 10, 15 minutes, but I was gonna take it. This is John McCain, he's a legend, and I go in and I meet with him, and I didn't come out of that office for about 90 minutes. And we both got emotional as he showed me pictures and documentation from his time as a prisoner of war. In 2017, he was under extraordinary pressure in this healthcare crisis, and there were thousands of Americans descending on our Capitol. I'll never forget the little lobbyists, they called themselves, kids in wheelchairs, that would roll up to Congress people and raise their little voice respectfully and ask them not to take away their health coverage. I remember people coming in here with pre-existing conditions and say, don't repeal my health care and not even have a plan to replace it. President Trump was asked about health care when he was candidate Trump for this office, and he said he had, I think it was conceptions of a plan. And since he's been in office, I haven't heard a vision for health care besides budget proposals that would cut people's health care. But John McCain, I will never, ever forget that moment. I was actually standing on the Republican side, if I remember correctly, having conversations, and he came to the floor after listening to Arizonans tell stories like the ones I've been reading and put his thumb down. He wrote a speech about his decision, and I want to read a part of that now. I have been a member of the United States Senate for 30 years. I had another long, if not as long, career before I arrived here. Another profession that was profoundly rewarding and in which I had experiences and friendships that I revere. But make no mistake, my service here is the most important job I have had in my life. And I'm so grateful to the people of Arizona for the privilege, for the honor of serving here and the opportunities it gives me to play a small role in the history of the country I love.